talk about USMLE study types, as you could imagine, there was so much focus on scores on USMLE, so important in all the specialties. And this is one of the parameters that they gauge your application. And the first thing they decide, most of the programs, they have a filter on your score. So we have a dedicated lecture on it. So first of all, I'm Ghulam Akbar, as Shifa said. I'm Associate Chief at Division of Cardiology at Lehigh Valley Heart Institute, Allentown. Been with the IMI for a decade. So as you know, USMLE consists of step 1, step 2, and step 2 used to be step 2 CK and step 2 clinical skills. And as mentioned earlier, step 2 clinical skills is currently suspended. And what I gathered from their reports look like they're not gonna start it anytime soon, but they're trying to figure it out to get your clinical skills assessed through other ways. And few of the way would be to add some clinical scenarios in CK as well as step 3. In step 3, so USMLE step 1 is basically, that's from the USMLE website. If you could see there, what exactly they want you to focus on is basically the concepts about all the diseases that you're gonna come across. The basic concept is basic science and the underlying mechanism, pathology associated with it. So these are the things that are going to be covered: and anatomy, behavior science, biochemistry, biostatistics, epidemiology. Especially this applies to our IMGs, especially from Pakistan, India, because there is not much focus on biochemistry, biostatistics, even macrobiology sometimes. And it's geographically, it's certainly way different when we read about macrobiology, because if you're taking USMLE, the question would be on macrobiology focused or prevalent in USA, not necessarily in Pakistan or India, because if you see, there are going to be a lot of questions in your medical school on malaria, TB, let's say, and typhoid. But whereas in USA, there will be a lot of questions on HIV, there will be a lot of questions on fungal infections, and biostatistics does carry some question in it. This slide will explain to you the percentage of questions that are carried out from general principles, are usually the most common one, and cover all the diseases, blood, immune systems follows, and then behavioral health. If you go to the left bottom slide, you see the pathology is essentially 50% is pathology, and if you focus on that, that will cover your half of the course, and physiology followed by the other subjects. CK is consists of internal medicine, OB, GYN, pediatrics, some of surgery questions, preventive medicine. Again, biostatistics and ethics come into play, and last but not the least is the psychiatry. The type of question that you get in CK are focused on diagnosis, prognosis, best test to order, the sequence, based on the clinical scenario, whatever they give you, most appropriate management, and apply basic science knowledge to clinical problems. And the other one is the preventive measures, what you should do to prevent a disease. Step 2 CK is based heavily on step 2 knowledge. There's a lot of overlap, and in my suggestion would be to take step 1 first before step 2. That will make your step 2 CK life easy. The timing of step 1, step 2 CK is variable, and it depends when you want to do it. I have seen people, of course, it depends when you change your mind and you decide about coming to USA, and when you start taking your step 1, step 2. if you are the person who is going into medical school and knows that again you're going to do step 1, step 2 CK, so my suggestion would be to take step 1 in your 4th year of medical school, because that's the time you have covered all your basic subjects and your knowledge is so fresh, but your mind should be ready and be prepared and start reading in keeping that in your mind. That will make your life easy. But if you're the one who has decided after completing medical school, and then of course you will be spending a little more time, and you have to take some special time out for that. In step 2 CK, let's say if you have taken step 1 in 4th year medical school, 5th year would be all your practicing and reading is your CK, and you're preparing yourself for final exam that will be essentially CK. So you can study for your final exam for medical school as well as you're preparing yourself for CK as well. So that's one way of doing it. May not apply to all of you, but certainly few people who have not started the process yet. Step 2 CK, step 3 is the exam that is the last portion of this series. It's the clinical medicine, patient care and clinical decision making. And this is the criteria that you could read as eligibility has a little change based on current scenario. Previously, as you know, would be you have to take step 1, step 2 CK, step 2 C as clinical skill, be ECFMD certified, then be eligible to take step 3. Now, because the CS portion is suspended, so eligibility, you should have passed step 1, step 2 CK, but not necessarily passed step 2 CS, have a medical degree from a medical school outside the USA or Canada that is listed in WHO medical school category, be ECFMG certified, and of course if you're IMG, and have taken any USMLE step component on or after January 1, 2015. And you have not failed step 2 CS 6 or more times. So if the person 3 years ago or 2 years ago have taken step 2 CS and have failed 6 times or more, he is not eligible to take step 3, even though step 2 CS is not required anymore, but it would apply to that scenario. The step 2 3S, as you know, is available in the USA only. It's a 2-day exam, and it's good to have it in your CV when you apply. I thought about adding some step 3 format, because some of you are planning or in the process of taking it. Is a 2-day, as I said. The first day there are 232 multiple choice questions, and they're divided into 6 blocks. Each block has 38 to 39 items, and 60 minutes is allotted to each block. And the second day there will be 180 MCQs. Again, will be in 6 blocks and 30 items. The items will be less. Then the 45 minutes allotted to Shifa. I'll be
no problem
coming in a minute.
No problem. So maybe what I'll do is
no, just give me a second.
Okay, cool.
All right, that's the life of a father on the weekend. Okay, so 180 questions divided into 6 blocks of 30 items, 45 minutes for each block. There are 13, the unique thing about step 3, there will be 13 case simulations, and each case would be allotted 10 to 20 minutes. And this is special, and everybody should be prepared for it, because they are unique and there is a way to do it. And if somebody has particularly planning to take and have questions, I'm happy to to address them separately. So what are the resources that you should be using or are available to you for USMLE prep course? Kaplan, USMLE Word, QBank, First Aid. I listed all of them, but I would elaborate on it. If you are studying for step one, I think Kaplan applies to all the USMLE. They're very good books. USMLE is very good for your questions. QBank, I personally would recommend just try it and see if you like it, but in my opinion, it's not that high yield. First Aid is good bullet points. Yeah, I think it should be handy and should be there. And NBME, I think NBME is a website that provides you questions, and then it's like a self-assessment questions. I'll talk on it. It's a very important thing. So NBME is basically you purchase your self-assessment questions on their website, and then you take them. You have the format. You can take it as you want to finish it in, let's say, as a typical exam, or you want to finish it in your more free time. In my opinion, I think that you should be taking it as this two-step. One step would be to see where you stand after you have finished your first or second read, and also to see where which area you're lacking, and that's you need to focus on in your last or the next read before you are actually going to take the exam. NBME questions are more or less very similar to what you're going to actually be seeing in your actual exam. That's going to be way different than USMLE U-World self-assessment question. So I would strongly recommend taking NBME at least two sets, in one right in middle of your study and second a few weeks before you're going to take your exam. So, how would you? There are a couple of things that I would like to say. There's not a single best way to prepare yourself. Everybody is different, and I can share my experience with you guys. My way of reading and preparing myself was way different than other people. Most of them was, so it's not a single rule that would apply to it. So you know yourself best. As I said, I did my NBME right after my first reads to know what area I need to focus on my next read, rather than knowing how good I have studied. The rest of the people, they were doing their NBME like 2 or 3 weeks right before the exam, and they're ready to do it. I thought that may not be enough time for you if you didn't do well in your NBME, or that you need more time to work on those areas. Of course, you should be taking advice from your seniors who have taken the exams. They'll tell you. Also asking them what type of questions they have. Certainly, most of the questions are repetition. Again, don't distract yourself by studying from everywhere. As I said, QBank, Kaplan, there are so many resources available to you, even online. So stick to few which are high yield and important. As I said, Kaplan is must, U-World is must. Study well in medical school. Again, there shouldn't be enough question about it, because it's all about what you learn in medical school. If you have studied enough, then it's easy to take these steps and perform very well. The technique of the question is very important. Remember, when these people make questions, they know the answer and they know what you should know. So they don't, and these questions are very well screened and studied before they become available to you in your question. So the technique is usually the question would have single best answer. There are usually not misleading questions, but whatever is in the STEM has some meaning to it. If the person is, let's say, has no risk factor for any, let's say, coronary artery disease, that means they are asking, they want you to know that probably the possibility is low. So they won't add anything that had no meaning to it in the STEM. So read this STEM very carefully. Rare conditions, I found them important, very important, because those questions are very easy, but they do come, and they have to come. But they are easy to answer because most of the time they are not focusing in the minor detail. But if you are coming across the common condition, pneumonia, heart attacks, MI, of course you expect to have a difficult scenarios. You focus more on that detail about it. There are some websites, most of you were aware, Student Doctor Network, USMLE Forum, USMLE official website. This is another website, you'll have a lot of forum to it. Again, these are the official resources that are available. I think this was covered before. So I'll end on my slide here.